Thank you so much, Dr. Shihab. Good afternoon, ladies and gentlemen. It's a pleasure to see you all here. My talk today is on inclisiran, which is a new and novel therapy for lowering LDL cholesterol. We all know that LDL is one of the top modifiable risk factors for cardiovascular disease, the others being high blood pressure, diabetes, smoking, obesity, and obviously diet and lifestyle modification play an important part. So LDL lowering is an integral part of the recommendations for cardiovascular disease prevention, both primary and secondary. The treatment goal is an LDL reduction of greater than 50% or an absolute value of LDL less than 70 milligram per deciliter in patients who are high risk, and an LDL reduction to less than 55 milligram per deciliter in patients with cardiovascular disease or who are very high risk. So who are these patients who are very high risk? These are the patients who have the ASCVD risk score of greater than 10%, who have severe kidney disease, who have diabetes, who have target organ damage, who have familial hypercholesterolemia with another major risk factor. So these are the very high risk whom we have to target to reduce the LDL cholesterol to less than 55 milligram per deciliter. So this is a study which was done, Da Vinci study, which showed that many patients are unable to consistently achieve and maintain the LDL goals with the current available therapies. So in this study, statins, as we all know, were the mainstay of therapy for cholesterol lowering, with 94% of patients in both primary and secondary prevention group being on established statins, who were advised to take moderate to high intensity statins as a monotherapy. However, interestingly, only 33% of these patients attained the overall LDL goals mentioned in the guidelines. So what was the reason that these patients, in spite of being on these statins, could not achieve the established goals? One was the patient's reluctance to be treated with high intensity statin. We have all seen in our clinics where if you up the dose of, say, rosuvastatin to 40, patients are reluctant, no, why don't you give me 10? So we have all experienced this. And sometimes there's high cost of these medications. They are concerned about the statin-related side effects, and sometimes on the physician's part, lack of familiarity with the current guidelines, and they do not lower the LDL goals to, say, less than 70 milligram percent in high risk or less than 55 in the very high risk. So inclisiran is a new and novel therapy. It is the first and only LDL lowering agent which acts through small interfering RNA therapy, which selectively targets the liver. So by preventing the production of PCSK9, it increases the hepatic uptake of LDL cholesterol and reduces the LDL cholesterol in the bloodstream. And it mimics the body's natural process of RNA interference. And the GalNAc conjugation of this molecule allows the specific uptake by the liver, and the likelihood of off-target binding of this is very low. This molecule has been studied in greater than 3,500 patients in 3 large pivotal trials. The Orion 9, which included patients with familial hypercholesterolemia who had LDL cholesterols of greater than 100 milligram per deciliter. The Orion 10, which included patients with cardiovascular disease with LDL greater than 70 milligram per deciliter was the inclusion. And Orion 11, which included patients with cardiovascular disease and another risk equivalent. If you had ASCVD, the LDL inclusion was greater than 70, or a risk equivalent, the LDL inclusion criteria was greater than 100 milligram per deciliter. The treatment period was 18 months. So patients, this was the design of the trial. Patients were randomized to receive 1:1, either inclisiran or placebo over an 18-month period. The dosing of inclisiran was day 1, then day 90 or 3 months, and subsequently every 6 months, to day 450, and the trial studied the patients till day 540, which is 90 days after the last dose. The primary endpoints focused on the percentage change of LDL from the baseline. So there was a change of LDL baseline from day 1 to day 510. And the interesting secondary endpoint, one of the second and primary endpoints was the percentage change after day 90 to day 540 to see whether there was a sustained reduction over this period. So these were the results from Orion 9, 10, 11. If you see, there was a significant reduction in the LDL percentage ranging from 47 to 53 from the baseline, and there was a sustained reduction from day 90 to day 540 with inclisiran. So it was not only an initial reduction, but it maintained, in spite of only 3 injections, it maintained the lower LDL levels. So this was the Orion 10 result, which if you see, there was a 52% effective LDL reduction from day 0 to day 540. And if you see the sustained reduction, it was 54%. And the similar results were obtained in Orion 11, 50% effective LDL reduction and 49% sustained reduction over the whole length of the trial. So inclisiran allows an effective and sustained LDL lowering with 2 doses. So as I said, the initial dose, then at 3 months, second dose, then every 6 months. It can be easily administered by a healthcare provider. You don't need to refrigerate the injection. There's no pre or post injection monitoring. There's no dose adjustments for renal impairment or mild to moderate hepatic impairment. Inclisiran was generally well tolerated in all the 3 pivotal trials across the 18-month period. The only adverse effect associated with inclisiran was at the injection site, which were mild and transient. And the discontinuation of the drug was balanced in both the arms. So it's generally a very safe and well-tolerated medication. So what does this data mean for us and mean for our patients? So it's an easy dosing schedule, twice yearly. The ability to achieve the target LDL guidelines with an injection which is well tolerated and has an effective, very safe profile. And there's a sustained LDL reduction throughout the treatment period. So this slide illustrates the adherence to treatment. So if you simplify, it's very easy to understand the slide. So if you simplify a treatment regime for a patient, the adherence is better, the LDL reduction is better. So if you see, you have to take statins 365 pills a year. If you look at other available therapies to reduce the LDL cholesterol, like monoclonal antibody therapy, then you have to give 26 injections in a year, once every 2 weeks. Whereas with inclisiran, you have to give 2 injections a year. So obviously the adherence is better, the LDL reduction would be better. So the key messages basically are that we have seen that many patients are unable to achieve consistently low and maintenance of their LDL goals with the current available therapies. We all agree that LDL lowering is an integral part of cardiovascular treatment recommendation in all the guidelines. And we have seen that 2 maintenance doses of inclisiran per year in all the trials achieves the effective and sustained LDL reduction. So I'll now go through real-hand experiences of our experiences with inclisiran. So case 1, this was a 46-year-old Indian gentleman who had premature coronary artery disease. Angiography showed severe triple vessel coronary artery disease. He underwent bypass grafting operation at the age of 41. He was hypertensive, hyperlipidemic, and diabetic. These were his lipids. I'll go through the medications he was on. He was unable to tolerate statins. His total cholesterol was 205, triglycerides elevated at 248, low HDL, and LDL obviously is in the high risk. So his, according to the current treatment goals, the LDL should be less than 55. And these were his liver function tests. These were the medications he could tolerate, but his compliance was not good because of the side effects. He could not take statins, so he was on Lipanthil and Azitrol. That also the compliance was not great, and the other agents to protect his heart. And he was initiated on inclisiran, the first dose given on 25th September last year. And he has had 2 doses of inclisiran so far. And these are his lab results after the second dose of inclisiran, where his LDL has dropped from 127 to 49.3. His triglycerides have improved. His total cholesterol has dropped. So it has shown a 61% reduction in LDL cholesterol, and he has achieved the target goal recommended by the guidelines with a simple dosing schedule, which was easily, done by a healthcare nurse in the hospital. So this is another case which I want to highlight. This was a 53-year-old Indian gentleman who has undergone multiple percutaneous coronary intervention with stents, and his only modifiable risk factor was hyperlipidemia. And these were his lipid profile, where his total cholesterol 164 and LDL 98.6, again much higher than what is recommended by the guidelines. Again, he was on 40 milligram statin. We tried him on 80 milligram, but he could not tolerate. We added Azitrol. He could not tolerate the Azitrol. So he was inadequately treated on the current maximal tolerated drugs. We started him on inclisiran on 5th of Jan, gave the first dose, and he has had 2 doses, which he has tolerated quite well. And these were his most recent, after the second dose, which achieved a more than 50% reduction in his LDL levels. His LDL has now dropped to 49, triglycerides 64, HDL 55, and LDL 117. Achieving his treatment goal, the patients are obviously much happier with this easy dosing schedule, which is very effective, which we are unable to do with the currently available statin or Azitrol therapy, which the patients could tolerate. And this is my last case. So This was a 48-year-old Croatian gentleman, again chronic ischemic heart disease, young patient, multiple angioplasty. In 2015, had a non-ST elevation myocardial infarction and had 3 stents. Subsequently had another acute coronary event in 2020, again needing angioplasty and stenting. Inadequately controlled cholesterol levels with LDL of 88, total cholesterol 136, normal liver function test. He was on Crestor, 10 milligram, because he could not tolerate higher doses. His liver function test would become abnormal. Ezitrol, alternate days, aspirin, beta blocker, ACE inhibitor. Again started on Leqvio, first injection given on 18th of November last year. And these were his levels. LDL had dropped to 44, triglycerides much improved, total cholesterol 86, again showing a sustained reduction after 2 injections. So these are real life cases which we all encounter, patients who can't tolerate statin or who can't take maximally tolerated statins, in whom this novel drug therapy has a big role to play. The patients are much happier with this type of dosing schedule, much easier, the compliance is much higher, and the adherence to therapy is much higher. Thank you for your kind attention.
Thank you very much.